name is Ray Thomas. I am the Research Education Lead for the Tropical Australian Academic Health Centre. We are a research translation centre. There are 12 across Australia, and there are 2 in Queensland. One is based in southeast Queensland, known as Health Translation Queensland, and we are based in northern Queensland. So we represent communities from Mackay. You draw a line across from Mackay to the border, and all the way up to Papua New Guinea, and they're the people that we work with. Okay. Sorry, just working on things. Okay. So TAAHC acknowledges the Aboriginal people and Torres Strait Islanders as this country's First Nations people. We recognise... Oops, thank you.
Isn't it?
We recognise First Nations people and communities as traditional. Someone's got their mark on. As traditional and cultural custodians of the lands on which we live and work, and we pay our respects to elders past, present, and emerging. So just a little bit about TAAHC, as I said before, we are a collaboration of 5 hospital and health services in northern Queensland. They're Cairns and Hinterland, Mackay, Northwest, Torres and Cape, and Townsville. We also have NQPHN as a partner, and the Queensland Aboriginal and Islander Health Council and James Cook University. So the things that we do, we provide research and research translation training. We provide statistical consults and analyses. We support people in appropriate study design, and we have grant rounds. And if you haven't yet checked us out, maybe you should have a look at our website, and that's where you can find us there. I hear lots of people coming in, so that'd be great. So today's presenter, I'd like to introduce you to Caitlin Brandenburg. She is very busy. She is a Principal Allied Health Research Fellow in a conjoint position at Gold Coast Health Service and Bond University. And she's also a Health Practitioner Research Fellow at Metro South Health. She specialises in health services research, knowledge translation, and descriptive qualitative research. Caitlin supported and mentored many clinicians who are new to research to undertake their research projects that require qualitative analyses. So I'm going to stop sharing my screen, and I am going to hand over to Caitlin, who can share her screen. And welcome, Caitlin, and thank you very much for your presence today.
Thank you for that. I'll just go presenter mode. And I can't see you guys. Oh, there we go. Is that showing okay for everyone? Yeah, perfect. So thank you for having me here today to talk about one of my favourite topics, which is qualitative research. And I think the thrust of this session really is on a really broad overview and demystifying some of the things out there about qualitative research. It certainly isn't intended to be comprehensive. It's intended to give you a bit of a guidance so you can go off on your own and look up some of the more specific things to do with your study or your interest area. So Ray already did an acknowledgement, but I do want to acknowledge the traditional custodians on the land on which I am at the moment, which is the land of the Yugambeh language speaking nation, and acknowledge any Aboriginal and Torres Strait Islander people present today. So I'm just getting over a bit of a cold, so my voice is a little bit weak. So again, this is a broad overview today. I'd also like to acknowledge that my background is in health research, and certainly in more descriptive approaches. So we tend to take a little bit less of a theoretical and a more practical approach to qualitative inquiry. So that's where my background comes from and where my expertise is in. So today I'm going to go through the general nature of qualitative research, qualitative methods, data collection, ethical considerations. There's going to be a focus on the data analysis component of qualitative research, a little bit on rigor, and a little bit on publication and reporting of qualitative studies. Because it's quite a long session, I put little times for questions throughout the presentation, but you're also welcome to put questions in chat or put your hand up. There's also some, I guess, interactive elements of the presentation. So I might ask questions, and again, you're welcome to type things in chat or put your hand up and do it verbally. Either way is fine. So on to the nature of qualitative research. So when we do qualitative research, we're really wanting to provide an in-depth subjective information, including personal experiences or opinions. Qualitative research is really good at dealing with unpredictable responses or even unpredictable questions. So you start out with your research question, but you may find more questions along the way. And qualitative research deals really well with that in a way that quantitative research is less able to. It's also worth noting that qualitative research is usually exploratory and hypothesis generating rather than hypothesis testing. So when we do qualitative research, we're looking at the subjective reality of something as perceived by our study population. Qualitative research can be used to explore feelings, relationships, experiences, opinions, and it really looks at the how and the why of something rather than the details of the what and the when. Qualitative research designs are flexible and dynamic. They're what we call naturalistic, so they occur in the natural context in which people work, live, play, whatever, rather than bringing them into, a lab to study them sort of thing. And it looks closely at spoken and written words and actions. I also want to note before I get too far into it, the presence of mixed methods as well. That qualitative research, especially in health research, is often done in the context of mixed methods. And if you are doing mixed methods in your study, be sure to couch your qualitative component within a larger mixed methods approach or design. So there's some of them below there. So explanatory, exploratory. Is your quantitative going to come first or your qualitative? Or they go side by side? And does one have bigger emphasis than the other? So moving on to qualitative approaches. So whereas quantitative research uses PICO, population, intervention, comparator, outcome, and time, when we look at qualitative research questions, we can use a different type of PICO. So you're looking at a population. So who or what is your population of interest? What is your phenomena of interest? And what is the context in which you're doing your research? So context is really important in qualitative research. There's also other acronyms that are used for qualitative research questions, but I tend to like the PICO format the most. So on to qualitative research designs. One of the things to note about qualitative research is that we aren't great at agreeing with each other, and that will be a little bit of a theme in this talk. There are many different opinions that abound in qualitative research, so I do want to note that. So if you've learned something different or different terminology, that's fine too. This is just the way that I've learned and what I've learned through my readings. So there is disagreement about what qualifies as an approach or a design or a methodology or a technique, etc. I usually use the term approach, which I think is possibly the most common in health research. And there's also disagreement about what constitutes different approaches. But the most important thing to remember is to name an approach. So a lot of early researchers venturing into the qualitative space often name a method, a data collection method. So a qualitative interviewing study, that's not an approach, that's your data collection method. Or they'll name a type of data analysis, so a thematic analysis. That's your analysis method. It's not your approach. So make sure that you identify and name an approach. So this is sort of the, I guess, flow diagram of things, components that you need in your methodology for qualitative research. So you obviously need a research question. I'm going to talk about paradigm in a second. You'll need an approach, which I'll also talk about in a second. You'll need a data collection method, so interviews, focus groups. Are you observing people? Are you taking video? Are you just working off a text document? Your data, and then your data analysis or interpretation method. So talking about paradigm, I'm certainly not an expert in this, so I will flag that just up top. It is highly important in some fields like sociology, and I think it's really important to have a mentor help you with this if this is something that you need to name for your study. The important thing that I always take home is a paradigm helps you be aware of how you're interpreting your qualitative data. So quantitative research usually sits within a positivist paradigm. So it's seeking objective facts, and it's built upon the idea that there is one single objective truth out there that you are trying to get or trying to measure. So what is the percent of people that have this disease? What is the best drug for treating this disease on this outcome? So there's one single source of truth that you're trying to get at. Qualitative research sits more in an interpretivist paradigm, is the one that I usually use, although there's other paradigms like realist and constructionist. But really, it's coming back to the idea that you're trying to understand people's subjective realities. So it comes back to that idea that we build reality, we build and interpret reality within our own brains, and qualitative research is used when we're interested in that subjective reality of what people think or feel or how they experience something. So understanding their lived experience is a term you'll often see. So a little bit of a question for the group. So if you are interviewing your participants and they say there just isn't any education available on X topic, but you know personally that there is education on that topic that's offered regularly at your site, should you, in qualitative research, leave it out of your results because you know it's not true, there is education offered, or do you too leave it in the results and comment on the fact there's existing education in the discussion? So if you want to type your answer in the chat. Got some twos, explore their perception, twos. Yes, all correct. Fantastic. So it's certainly the second option. Yeah, great. So within qualitative research, we're really interested in people's perception of something. The objective reality, unless it's part of mixed methods, it doesn't matter so much. We can certainly comment on it, but really there's that subjective, we're looking at that subjective idea of, do people think there's education? And then if there is education, well, why have people said that? Is it because that education isn't advertised well? Is it because they go to it and it just doesn't hit the right points that they need? Is it because they do the education then forget about it? And what is it that's making it forgettable? So we're really looking at that subjective perception of what's real. So on to the approach of the design. These are the main approaches that I certainly use. Sometimes they're known as the big five. I add a sixth, which is descriptive. So phenomenology is an approach which explores phenomena, which can be an event, situation, experience, or concept. And it really focuses on that idea of lived experience and looking in depth at someone's experience of something. So it usually involves typically less interviews, but more in-depth, long interviews. Then there's grounded theory, and that's a very specific type of approach where you're looking to develop a new theory that's grounded in the data. And it often includes multiple data collection types, including literature review. It also has a really specific approach associated with it, including in your analysis. There's ethnography, so that's studies which describe a culture or a group of people. And it usually infers a deep dive study, which includes some sort of field work or observation, along with interviews or focus groups. Descriptive is the approach that I have most experience with, and it's really a sort of, I guess, a catch-all approach for studies which seek to describe a subjective experience. So if you're looking at, healthcare workers' perceptions of a certain intervention or population group, I think descriptive kind of fits really well for most of the research that we tend to do in health, including evaluation and mixed methods type research. There's narrative approaches where you're looking at building a story from the data that has a sort of timeline to it. And then there's case studies where you're looking in depth at a unit of study. And often you're using multiple types of data collection for that one as well. Any questions on what I've covered so far? So feel free to type in the chat or just pop up your hand. It's a really quick overview. Yes, Neil.
I'll break the ice. I, I don't know whether you'll cover this, but I'm very interested in how in qualitative research you manage your own personal biases and prejudice and all the prejudgments that we all have to some extent. And yeah, just be really interested on tips and tricks on how to stay as objective as possible.
I'll talk a little bit about that at the end. We call it reflexivity in qualitative research, which is understanding your own perspective and acknowledging that that will be put onto your data. So I guess in qualitative research, we don't seek objectivity. We acknowledge that we can't be objective, that we are humans that come in with our own opinions, our own experiences, and we do put that to an extent into our data. But obviously there's a limit that it's hard to get the kind of limit, and certainly different for different qualitative approaches and paradigms. There used to be within qualitative research a process called bracketing. So the idea of this bracketing was that you would really confront your own biases and your own opinions, and you would put that to the side when you did your qualitative research. We've moved away from that as a field because it was determined that that's kind of impossible. It's kind of impossible to fully take yourself and put yourself in a corner, everything that makes you you, and then do your qualitative analysis. So it's more about documenting it and understanding, and also working with other people in your analysis to make sure that you're not over interpreting or putting too much of your own interpretation on things. But I'll cover it a little bit at the end as well. Yeah. Any other questions? I'll keep going. So looking at data collection in qualitative research, so this is a sort of a metaphor for how the two types of research differ. So for quantitative research, you have a plan and you have a really detailed protocol about what data you're going to collect at what point in your process. With qualitative research, you're more coming in on a big unexplored area and kind of narrowing in on a topic from the outside. So it may not all be clear from the outset. I also like to compare it to going Easter egg hunting. So you're looking for those rich pieces of data that are going to help you answer your research question and describe the phenomena that you're interested in. So in qualitative research, your data collection and analysis will occur at the same time in most designs. Quantitative research is about collecting complete or analyzable data. And so most of that effort and thought is in that planning process and making sure that plan is followed. So creating a really detailed plan about exactly what data you're going to get. Qualitative research is more about collecting rich data. And that collection process is more nuanced and needs more attention as you go along. So effort and thought is needed during the process of collecting data, and the plan is not always exact and may change. So this has implications for how you're scheduling things. So you may want to be scheduling lots of meetings with your team or with your mentor through the process of collecting data so that you can have these discussions with them. Are we getting the data we want? Is the data rich? Are my interviews good? Are we getting to the picture that we want to build here? Data collection methods in qualitative research. Interviews are the most common within health research anyway. Focus groups are also very common. Questionnaires and surveys, question mark over that, because for a survey to be truly qualitative, you need rich data in that survey. So often we have like a really quick open-ended question on a survey, and people type like maybe a sentence or two. And then categorize it, and then you count the number of people who've answered for each category. That's not really qualitative research. Obviously it has elements because you're working with words and you're trying to theme and categorize them, but it's probably not true qualitative research. unless it's a very specifically designed qualitative survey. You can also have observation and field notes. You can be analysing text, or you could analyse some sort of video or even a piece of art, which is not my expertise, being in health research. So a little bit on sampling in your qualitative research, because we do use quite different sampling methods. So the first type is convenient sampling, and that's basically grabbing anyone who fits your inclusion criteria and trying to include them. So an example of that might be sitting in an emergency department and kind of giving people a survey or asking people questions as they walk by. That's just whoever's convenient. Snowball sampling can be combined with other types of methods, and that's where you're getting the people that you interview to refer on or pass on the information about the study so that you can get more people through them. So it's that idea of a snowball picking up as you go along. And that's a really useful kind of sampling for populations that are harder to reach and that have a community around them, so that people within the group will know other people within the group. There's then maximum variation sampling. So that's trying to sample people at different ends of a spectrum. So for example, you might want to sample people who are in very metro areas versus very rural, and maybe you're not interested in like suburban or regional, you're just trying to get the two extremes, or people who have a really short length of stay versus a really long length of stay. So you're just looking at that extreme end. Theoretical sampling is quite specific to grounded theory. So you're sampling according to your developing theory and the information that you need to continue to build that theory. There's then extreme or typical case sampling. So a little bit similar to maximum variation. You're either looking at only very typical cases, you're not looking at the outliers or the extremes, or you're looking for only extremes. So who are the people who had more than 3 diagnoses who were admitted to our ward, or who are the people who are taking over 10 medications, you know. Total population sampling is also used in qualitative research, especially in a pragmatic sense. So for example, you want to look at how the nurses on a ward experienced some sort of change to their clinical practice. Well, there might only be 20 nurses that work in that specific ward that have experienced that change. So really you're trying to sample that total population for your research. Even if you don't end up recruiting all of them, the sample that you're trying to get is total population. And lastly, the most common one that I see in health research is purposeful sampling. So that's basically selecting participants who can best inform your research question because of some sort of characteristic that they have. And I often see this in papers that I'm reviewing without describing what those characteristics are. So make sure you're always defining and describing those characteristics with which you're purposefully sampling someone. So a lot of the time in healthcare, that might be you're trying to get patients who have different levels of education and are of different genders and ages. Maybe that's important to you for your research question. If you're sampling clinicians, you might be trying to get clinicians of different streams, so nurses, doctors, and allied health, and maybe different levels of seniority or something like that. So make sure that you're naming the way that you're purposefully sampling. And when I get people to think about what's important to them, I often ask them, at what point would you stop sampling somebody? So for example, if you're interested in people's experiences of something on a ward, if you had 10 nurses sign up and no doctors, would you keep sampling nurses, or would you stop sampling nurses and really try and go for the doctors or for the allied health? So often that's a good way of thinking about it, is if I got too many of a certain group, would I turn them away and stop sampling them in lieu of somebody else? So sample size is not predetermined in qualitative research. Sample size is related to data sufficiency. So this was previously called data saturation. That might have been a term that you've seen in places, but we now usually talk about data sufficiency. I won't go into all of the reasons behind that, but you can use either term. So data sufficiency is built around the idea that you will stop sampling when you stop finding new pieces of information and the data becomes repetitive. So in research protocols, you usually would say that you'll sample until sufficiency and then give some sense of how that will actually be determined. So are you going to determine that as a primary interviewer or a primary analyst? Are you going to determine that with the help of your overarching research team? Is it going to be a group decision? You know, just giving a little bit of character around how you're going to make that decision to stop sampling. Just as a hint and estimate, because although we can say that we're sampling until sufficiency until we're blue in the face, practically for grant applications and for ethics, we often have to name a sample size, unfortunately. So for a typical descriptive interview-based study, usually 20 to 25 people is a good kind of rule of thumb. It will be a little bit less for phenomenology because you're looking more in depth at a smaller group of people. And it will be more for grounded theory because you're building a theory out of the data and doing your theoretical sampling, which looks a little bit different. Do be aware that that sample size will increase if you have multiple characteristics in your purposive sampling strategy. So for example, if you want to sample staff from different sites, levels of seniority and profession, that's quite a few things that you're trying to sample on. So if you only had 15 people, you can see how you might not get a junior nurse from this site and a senior nurse from that same site and a doctor, you know, like you're trying to sample multiple different types of people. So it will probably have to be a bit bigger. So looking at that definition of what is sufficient, there are certainly papers and a lot of resources you can go to help you understand this a little bit better. But really, it's the point at which collecting more data is not going to give you much more information about your research question. So another hint that I kind of learned along the way is if you have any sort of segments for your participants, so if you're looking at comparing or looking at experiences at different sites, you will have to achieve sufficiency for each site, if that makes sense. And usually experienced qualitative researchers describe sufficiency or saturation as the point when you ask a participant a question and you almost know what they're going to say. And you're hearing the same things again and again. And those things should be related to that main research question. So you feel like, I don't need to do any more interviews. Like, I think we've heard the same thing time and time again from people. I think it's time to stop sampling. So transcription and analysis of your interviews or focus groups, just as a pragmatic sort of set of information, you can use a transcription service for that. Those are, they come with a cost, but they're really nice. Like the accuracy and what they send back to you makes your analysis so much easier, but you don't always have funding. So you can also use the sort of automated AI transcription. It is getting better and better. I will say that, but it does still need correcting, and that does still take, you know, a bit of time. So I usually estimate 2 hours for every 1 hour of recording, maybe 3 hours, depends how accurate the version you're using is. Also be aware when using automated transcription that it needs to meet the ethical standards for data privacy. So if you're within Queensland Health, that needs to be the Teams transcription or something within the Queensland Health environment, and similar for other organisations. You can also transcribe yourself, which takes about 5 hours for every hour of recording. So especially in the era of automated transcription, it would be rare to do that these days, but sometimes if you have particularly sensitive data that you don't want to send anywhere, you might still be doing transcription. Also consider the qualitative analysis software that you may use. So NVivo is really popular in Australia and in health research. That's the tool that I use most of all. But if you don't have access to in vivo, you can still use just Word or Excel documents to do your qualitative analysis. There's nothing wrong with that. Even, I mean, you do want to do it in some way digitally so that you have that trail of your analysis, but even printing it out and doing a little bit by highlighting and writing, if that's something that suits you, it's a perfectly valid way of doing your analysis as well. Any questions about that set of information before we move more into the analysis? I'll assume no. Everything is perfectly explained. Ethical considerations for qualitative research. So often we think about, especially if you're coming from a health background, where we, inject people with untested medications as part of research and things like that, we can often think of qualitative research as having no risk, but it does come with risk, and we need to acknowledge and mitigate those risks as well. So when you go to your ethical review board, it's never about having research with no risks. It's about the fact that you've correctly identified and have a plan for mitigating those risks. So you want to make sure your participants are as informed as possible about the potential risks and justify why the merit of your study is worth those risks or burdens. So for qualitative research, your research topic may have potential for risk if it's sensitive information, if it's stuff that might be upsetting, if it's asking staff members to criticize maybe their management or their organization. Those topics come with a little bit of risk. Also consider risks associated with your participants. So is there a power imbalance? Are you a director or a senior medical person who's interviewing junior doctors? And how will you mitigate that? Are you interviewing vulnerable groups within your community? Are they patients that are highly dependent on care, etc.? Consider consent and how that will be informed, making sure that people fully understand what they're consenting to, and that may involve, if you're consenting people who have language difficulties, languages other than English, children, etc. Also think about recruitment, how your participants will be approached, making sure they don't feel coerced or pressured into participating. But then on the flip side, giving people an opportunity to participate. How will you give equal opportunity? Because sometimes people want to tell their story and be involved in that research. Consider in your data collection your interviewer, what their role is and the potential relationships that they have with their potential participants. Are there any existing relationships? Is there a power dynamic there? And focus groups, you'll want to address confidentiality with the other participants in the room. And certainly with data, everything that we do for quantitative research, so the identifiability of your data, privacy, storage, and access for that data. Qualitative research is inherently highly identifiable, even if you redact the transcript. These are people's stories, experiences, thoughts. So you have to be, very responsible with how you deal with that data and how you redact it when you're presenting or publishing it. And as always, consult the National Health and Medical Research Council National Statement for Ethical Considerations in Human Research, which was updated in 2025 for more guidance around the kind of ethical component. So moving on to data analysis. So another metaphor here, so with quantitative research, you're always wanting to maintain that objectivity and that distance from your data. But with qualitative research, as we sort of touched upon before, you are going to have a very close relationship with your data. And you also put some of yourself and some of your interpretation and your experiences into your data just inherently by engaging with it and by being the person who is ultimately going to decide what that data looks like and how it's presented to the world. We always want to be aware of that. Again, with other types of qualitative research, the terminology used for data analysis types does differ a lot between different people, so do be aware of that. These are the main types that I learnt when I was trained. So thematic analysis is generally seen to be a more interpretivist approach. In health, a lot of us use the Braun and Clark approach, which is the reflexive thematic analysis approach. You can also use qualitative content analysis, and this is generally seen to involve less interpretation and be more descriptive. We usually say more close to text. And Granahan and Lundman was the version of that I learned. There's content analysis as well, which usually implies quantification of results, so doing counts, which is probably the only type of qualitative analysis that use counts. There's grounded theory or constant comparisons, and that's very highly linked with the grounded theory approach. You wouldn't usually use that for other approaches. And then there's conversational or discourse analysis, and that's really looking at not necessarily just the content, but also the way that people speak to each other. Often that's used for sort of video analysis. So if you have a video of a clinician interacting with a patient, you might be also interested in, well, how much does one talk versus the other, or what's the language that's used, etc., as well as the actual content. So when we're trying to prepare for publication of our results and reviewer two, as we call it in academia, which is the reviewer that's going to be very critical of you, we can do some things at the point of choosing our analysis type that's going to help us at the end to defend it to a reviewer who might have a different idea of qualitative analysis than us. So make sure that you're choosing your analysis approach very deliberately, rather than one that you're just familiar with or that your mentors are familiar with. Make sure that's a deliberate choice. Identify a specific article or reference to guide you through the approach. So like I sort of mentioned, thematic analysis, I use Braun and Clark. Braun and Clark is a specific method within that. You can use other ones, but just make sure you have that reference of the specific thematic analysis approach that you've used. Don't be tempted to combine elements of different approaches, just stick with one. That's a lot more defensible when it comes to publication. And make sure that as well as just referencing the approach, you describe the approach in your article. So key considerations for qualitative data analysis. No matter what type you're using, they usually contain fairly similar steps along the way. So one step will be familiarizing yourself with the data. So usually the first step is reading the text, so reading your transcripts and getting a full sense of the content before you start coding. So this is an important step in really making sure that you have a sense of the whole of your data rather than diving straight into the details. As I said before, you'll need to talk about timing of your analysis. So it's really good to start thinking about analysis from the collection of your first piece of data. And often you're doing that data collection and analysis alongside each other. So in most forms of qualitative research, they should be informing each other. So if you're doing your analysis alongside your data collection and you think, oh, this is really interesting, but we don't have enough detail about that, you might add a prompt to your interview guide that starts prompting a bit more detail around that thing that you're interested in. Like I said, qualitative research is iterative and it changes over time, and that's fine for the approach that we're using. And you should also consider this pragmatically when scheduling your interviews. Sometimes we can't get away from it. If we have, for example, a research assistant for a defined amount of time to do interviews for us, we just have to get all those interviews done within like a 2-week period, and we can't do our analysis alongside. But if you can, make sure that you're spacing out those interviews a little bit so that you can do analysis in between. And qualitative data analysis is almost always emergent and iterative. So you'll analyze different pieces of data, but you'll go back and revise and think again and restructure. That's just part of qualitative analysis. I'll now move on to talking more specifically about thematic analysis as sort of the most common type that we see within the projects that people do in health services. So I just want you to be aware of these common terms when it comes to coding qualitative data. So the first is around where you're deriving your themes from. So open or inductive coding is where you're coming in with no predetermined codes and you're determining those codes from the text. So you're making them up, as they say. The next is closed or deductive coding, and that's where your codes are predefined from another source. So this would be at odds with a thematic analysis approach, but is a valid way of doing your qualitative research. So you already have a list of codes that's been developed as part of a framework or previous qualitative work or something like that, and you're just coding your transcript to those existing codes. But there is also a whole world in between those two things. So if you've used some sort of guiding framework or theory to inform your research question or interview schedule, it's also going to bleed into and inform your analysis just naturally. And there's a gray area of how much it's going to inform it. So sometimes people use sort of a combined approach where they inductively code things and then they code it to that framework deductively. So they kind of do both. So yeah, it's really just up to your research question and your approach, where you sit along that kind of continuum from inductive to deductive. Some paradigms also make a distinction between manifest and latent content. So manifest content is taking at face value what the text says, and it's really easy to recognize in code. So someone says, oh, I didn't like the fact I was discharged early. Well, they didn't like the fact they were discharged early. So discomfort with being discharged early is pretty easy to code, whereas latent content involves identifying what was actually meant or underlies the manifest content and requires more interpretation of the data. So sometimes this can be things like looking at tone, the tone which someone said something in, but also the entirety of their interview and maybe other things or underlying things. Can also include bringing in things that you know about the environment or the culture of the person that you interview. If you share a culture, you might understand that, you know, someone might say something quite lightly, but mean it maybe a bit more intensely than comes across in just the written text. So a sort of one of the take-home messages of today would be that coding qualitative data is iterative and it's messy. And it is really, really normal to feel unsure at certain points on your journey. So pretty much with every project I do, I start out thinking, oh, great, I know exactly how to code this, is going to go great. And then I get overwhelmed with data and I just think, oh, there's too much data. I don't know how I'm going to ever code this. And then I get confident again and go, oh, this is coming together. It's making a picture. I'm really excited. And then I'll probably go back down again and come up again a few times during the process. So it's totally normal. You are usually coding tens of thousands or hundreds of thousands of words down into maybe 1,000 words or 2,000 word result section. So it can feel overwhelming at times and it can feel messy, and that's really just part of the process. It's very rarely a nice linear process where you're getting detailed codes and combining them up into higher order codes and higher order codes like that. It's usually a little bit messier than that. So one of the big questions I get about qualitative coding is, should we expect inter-rater agreement when we're doing our qualitative coding? So in inductive coding, we should not usually be looking for agreement. Deductive coding is sort of a different beast, but when we're inductively coding, the same researcher might get the same transcript and code it in a different way. And that's fine as long as it stays true to the data. So that's this idea that the data can have multiple meanings. As we said before, every researcher brings their own personality, their own experiences, their own culture, and it's kind of impossible for them not to bring a bit of themselves to this interpreting all of this data. So for that reason, most qualitative researchers, if you're doing a single coder or a single analyst approach, They'll focus on having that regular team discussion and agreement rather than two raters rating the same text and using a quantitative measure of inter-rater agreement. So certainly you can have two analysts, especially for your first few interviews, look at the text and do their own coding of it, but you're not looking for one-on-one agreement. You're just looking at having a chat about it. What did you see in this? What did I see in this? And checking yourself a little bit that you're not over-interpreting. So being reflexive is key. So being aware of and reflecting on your own experiences and how they shape the research. Sometimes to help with that, we keep what's called a reflexive diary as you're going along in your process, or discussing it with others and getting kind of sense checking. And this is where having a consumer co-researcher can be really useful. So someone from your participant group to make sure that you're not over-interpreting. Are you seeing the same things that I'm seeing? Is this what you think they mean, etc. And the buttons there are a reference to how I was taught this concept, was that we all had like a little, I guess, set of buttons and we were asked to sort them. So that was all the instructions we were given, sort these buttons. And then some people sorted according to the number of holes. So some are 2, some are none, some are 4, some sort of according to color, some by size. And then at the end of the lesson is sort of that everyone's going to sort qualitative data their own way. There's no way that's wrong. Second question that I get after I explain that is that if everyone codes things differently, then can I code wrong? Yes, you can certainly code, well, let's not say wrong, but there are different, I guess, levels of quality of your coding. So there are two responsibilities that you have as a analyzer of qualitative data. The first is to make sure that you're truthfully representing the data that you have. And the second is to make sure that that analysis is understandable and useful to others. So if you get too focused on one of these at the expense of the other, it can compromise your research. So if you have this really complex analysis that you think represents all the elements of the data wonderfully, but no one else can understand it because it's too complex for them, then you're compromising the ability of your science to be communicated with other researchers or people that are going to use it. On the other hand, if you focus on making it really easy to understand and you're compromising some of that meaning or that truth, well, then that's not good science either. So we want to keep that balance between the two. So some of the ways that you can do coding wrong, quote unquote, not staying true to that data, making too many assumptions, not considering your phrases in context. So it's easy once you start to code things out and look at them in isolation to forget where they've come from. You know, what was this person responding to? What was the question when they were asked that? What is their overarching story when they gave you that? Which is why it's important to keep moving between the smaller parts and the whole when you're doing your analysis to make sure that you're keeping that context in mind. For thematic analysis especially, being too concrete or keeping your codes at a low level of interpretation can be a weakness, and I'll have a little bit of an example of that later. You can have too few codes or codes at too high a level that don't really answer to your research question very well because maybe you've gone too far in collapsing them up. You can definitely have codes that are not explained well or that are difficult for others to understand. And you can also get a little bit distracted by stuff that seems interesting and then realize that it doesn't actually answer your research question. So coming back to that core research question, it is also important. The exploratory nature of qualitative research means that you're going to find out interesting stuff about related things as you do your qualitative research. So you can certainly keep a note of those, but always make sure that your themes are in response to your research question. So as an iterative process, when you start out on your coding at the beginning is probably going to be what I would call more descriptive. So that is very close to the text and may closely follow the interview questions. As you progress, your coding will develop as you begin to see those higher order themes, and often you'll need to go back and recode the first set of transcripts to better match what your coding ends up looking like. That's a perfectly normal part of the qualitative research process. So this is an example here. It's a real world example. So our participant said, I didn't like the doctor's tone. It seemed dismissive. So at the beginning, I've coded that very specifically under communication dash tone. But at the end, it ended up kind of being collapsed with a few other ideas to make communication and bedside manner. And it sat underneath an overarching theme, which was the relationship with the clinician can matter more than perception of pain. So you can see how that higher order theme is more interpretive. It's not just a summary of all the stuff to do with communication or all the stuff to do with the doctor. It's actually combining this other element of the perception of pain and combining those two ideas to make a more interpretive theme. So I've generated a few examples with Copilot AI, and I love people to give their thoughts in the chat or put their hand up around whether they think that this is a good set of themes. Obviously, it's hard to judge because there's thousands of words of data that would have theoretically gone into this. But as a reader, if you had the research question, how do early career nurses experience the transition from university to clinical practice? What do we think of that set of themes? Great, some great responses in chat. So it lacks description, it looks very broad, not detailed enough. Each of those can be interpreted differently. Generic, unclear, very broad, more concepts and themes. I can see we're not all beginner qualitative researchers in the group. We've got some experience here, which is great. Yeah, we'll need more description. So yeah, this is, I generated this with Copilot and I asked it to make some bad themes, basically. Well, let's not say bad, but they need work. So when we look at these themes, we don't get a real answer to our research question. So how do they experience it? Workload. Was there too much workload? Was there not? There probably was too much workload, but we can't assume. So maybe there wasn't enough workload. They didn't have enough to do. Was the team a good thing that helped them? What does the university theme mean? That university prepare them well? It doesn't really give us any description. Nervous is a little closer to experience, that they're experiencing nervousness, and then confidence, but how do those two seemingly, I guess, at odds emotions work together? So I don't really get an answer to our question. They're really just categories, or as someone said in the chat, concepts, rather than themes that answer to our research question. Great. I'll move on to the next example. So what do we think of these themes? Got some people saying much more descriptive, more emotional and reflective of experience, more descriptive, much clearer, more relatable and able to draw a connection to the question, which is a good point. Better, more descriptive, give better information. Yeah, perfect. So these are some nice themes. You can see even just with a few more words in each theme and a little bit more higher level interpretation than just a category, like a group of the same idea, like anxiety, you get a much better picture of that research question just from the themes. So people coming out of their degree have a shock of the reality of being a nurse. Then there's 3 things that support them. So learning through doing, having support, having emotional labor and resilience. And then 5, it's not super descriptive, becoming a nurse. Not quite sure. I think that one could use a little bit of work. So your theme should look a little bit like this. There's also themes, especially in thematic analysis, which are a lot longer. They're more like a sentence, which is also good as well. So they can be even more descriptive than this. Then I had one more example. Yes, so what do we think of these themes? Someone likes how it separates into positive and negative. Someone else has said it's more content analysis rather than interpretation. So I would agree with the second comment there. This is more an example of content, qualitative content analysis than thematic. So it's a little bit more descriptive. These are more categories rather than that thematic interpretation. That's not to say it's bad or anything like that. I think that if you were to do a thematic analysis, the idea of the top themes being barriers and facilitators, those are just buckets. They're not themes, but you could take that second layer and do a little bit more with that. So those are perfectly good ideas in that second layer. So workload, feeling nervous, lack of support, and combining them up into larger themes. And if you wanted to, you could keep that positive and negative kind of spin within those higher order themes. But sometimes I see people who are early in their qualitative journey doing things like this and putting things into barriers or facilitators or good things or bad things or yeah, just kind of buckets rather than themes. Right. Some practicalities that I often get questions about when you're doing your coding. So you can code paragraph sentences, part sentences. You can even code a single word if that's relevant to you. You can also code the interviewer's words where relevant. So if the interviewers asked a question and someone said, yes, brilliant, you'll probably want to code that question as well. So you know what's brilliant. You don't need to code things which are not relevant to your research question. So for some reason, beginners get this idea that every single piece of text needs a code, but it doesn't. If it's not relevant to your research question, you don't need to code it. And beginners also get confused about you actually can code things twice or even 3 times if they genuinely cover different ideas or different themes. You can code them to different places, but just be a little bit sparing with this, because if you go too crazy with it, then you just end up with a bit of a mess in terms of your theme structure. You should consider putting things under higher order codes rather than keeping coding them to different places. So with our last half hour, we have half an hour left, don't we, Ray? Yeah, okay, cool. I thought we would go through a little bit of a worked example for a study called the Watch House study that I worked on with the ED research team at Gold Coast. So the aim of this study was to understand emergency department doctors' experiences and perceptions regarding the appropriateness and management of detainee transfers from police watch houses to EDs. So a police watch house is where people go when they get arrested, essentially. So the methods were that it was a qualitative descriptive study using semi-structured interviews undertaken with ED doctors working in 5 purposively sampled EDs across Queensland. and we published this work. So everything I'm going to present to you today has been published. So this first set of quotes, so we're going to have a little bit of a practical experience with coding something. As I said before, it's, this is one tiny slice of a whole set of interviews. So there's not going to be a right or wrong sort of thing here. But if you wanted to read through that and give me an idea of what you think the code or the theme or the idea of these quotes are.
Sorry, Caitlin, what are we supposed to be commenting on again? I've got a bit confused.
Oh, sorry. The theme or the code or the category, like the idea that you think is covered by these quotes. So Ray has code equitable treatment. Neil is talking about perspectives on patient engagement, equity of practice, sameness of treatment. Yeah, perfect. Perfect. Equality, equal treatment, non-discriminatory approach to detainees. Perfect. All right. So that is one element of our analysis. And at the bottom, I just wanted to make it clear that all doctors said some version of this when we asked them about management of detainees, because I'm going to show you some other quotes. And I just want you to be aware of that context, that these are just example quotes that pretty much everyone said a version of this. So example 2, what do you think is covered by these quotes? So Peter has said that this covers a more conservative approach over investigating detainees as they're not easily accessible for follow-ups. Simon says, standards of practice. Variation in intervention choices or practices. Right? But does anyone think that these quotes conflict with the first set of quotes? Yes. So we have an interesting kind of dynamic here. And like, that's why I wanted to point out that, you know, all of these doctors, 4, 5, 10, and 11, and some of the others also gave quotes about equitable treatment. Yeah, so there's a little bit, yeah. And Peter says, yes, it's not the same treatment. Yes. So we had a little bit of interpretation to do here and a little bit of look at the latent content, which is why I gave this as an example about the difference between summarizing stuff and then actually interpreting it and building a picture of what we mean. So I will give you these as well. I'm not sure how much sense they're going to make without the picture of the whole, but see if you can you have any ideas about what theme or what topic these ones cover. So it might be a bit harder because I brought together a few different ideas. Continuity, treatment complexity. What question were they asked? Yeah, good question. Erratic nature of their circumstances, difficulty, plan long-term, challenging. Yes, great. These are some of the ideas. This is getting sort of closer to it. Communication barriers, police cannot give specific, yeah. So essentially problems or barriers or things they need to think about when they're treating this patient. So how do we deal with this data and make a coherent picture? How do we interpret it? So this is the overall picture that we ended up with. So essentially, we found that the doctors had this baseline approach of equality. So detainees are treated no differently to anyone else. We treat everyone the same here. So that was that first one that we went through. But then we then found that they talked about all of these circumstances with detainees that might actually impact their management in the ED, which was that last one that we spoke about. So the fact they're in restraints, they rely on police to access care, there might be some motivation to misreport symptoms, they're very, very complex, they come with a police guard, all of these other things that were actually impacting on that idea of treating everyone exactly the same. And so then I didn't get into 4, 5, and 6, which are about what strategies they use to address this. But then we come out with this theme of 7, which is that they're really working towards the outcome of equitable care. So care that's responsive to the particular circumstances of detainees or to the individual person that comes to them. So this is how we sort of interpreted and looked at that latent content between asking them what's different about how you manage detainees and getting the answer, there's nothing different, we treat everyone the same, versus the way that they spoke about there are differences or there are circumstances, but really they were talking about the difference between equality and equity. They're working towards the idea of equity. So this is a little example about the difference between those two things. So equality is giving everyone the same thing. So everyone gets a bicycle, doesn't matter whether you're tall or small or whatever. But the idea of equity is that everyone gets the same outcome, everyone gets the same quality of care, everyone gets the same opportunity to have good health care, even if that care looks slightly different for different people. And that's how we kind of put that interpretive layer over those individual quotes or themes that seemed like they were dissonant in some way. Great. So I don't want to move too quickly on. Does anyone have any questions about data analysis? So that was helpful, thank you. Don't be afraid to keep putting them in chat, but I'll move on. So moving on to the idea of rigor in qualitative research. So we find that rigor is often poorly addressed. Quantitative research talks about validity, but in qualitative research, we're concerned with rigor. So that idea of credibility, can we trust the findings? Dependability, is the project logical and auditable? So having something like in vivo with your coding is really helpful for that because you can always walk back and see the codes that you've used. Transferability, are the findings relevant to other settings? And to help support that, you always want to describe your setting and your participants in detail because you're really only representing the context that you're doing your interviewing in. And confirmability, so are the findings based in the data collected? So this was said to me by a quantitative researcher who was doing his first qualitative research project, and he said, it's just me looking at the words and deciding what they're saying. And I was like, oh yeah, that's kind of what qualitative research is. And that's why it's important that we build in that rigor and we build in that reflexivity and make sure that we're looking really closely at ourselves and how we're interpreting, and that we're doing that in a responsible way, because it is just you looking at the words and deciding what they're saying. So how do we do that in qualitative research? So if you're using different methods, you can do data triangulation. So looking at survey data or observation data or meeting minutes or whatever data you have and triangulating it to make sure it's all looks similar, or why doesn't it look similar? You can use multiple coders. As I said, it's useful to have someone at least read the same transcript as you for the first few that you're going to do, and then check how they're interpreting things alongside you. You can use participant checking, respondent validation, member checking. There's different words for that, but that's essentially sending back part of your data or part of your interpretation to the participant to get their opinion on whether you've interpreted their words correctly. Peer review and debriefing is really important. So getting your research team together and getting them to have a look at what you've done and whether you're going too far off track. Engaging with the data, so making sure you're always moving between the part and the whole, and you're not looking at things too much in isolation out of context. Reflexivity, so reflecting on your own role in the research and your own opinions and experiences that you're bringing in. Keeping good records about your coding decisions and having detailed reporting. So reflexivity, that's a definition from the Melbourne Medical School. I find that being able to keep what's called a reflexive journal is a good way to be aware of your reflexivity and support your approach to data collection and analysis. So you would have, after you do each of your interviews, you would reflect on emerging themes that you're starting to see just from doing the interview. Reflecting on your interview style and content, that helps you make changes to the interview guide if you need them. Terminology, non-verbal information from the interview, and having other notes. So lastly, publishing in qualitative research. So as for all types of research, there are reporting guidelines that you can use for qualitative research, but they're also useful for planning your research and making your protocol. And so the CORE-Q, or some people call it the COREC, is a useful tool. But also the RATS guideline, they're all available in the Creator network. They are a little bit limited when it comes to qualitative research, and some qualitative researchers are a little bit, I guess, critical of the idea of using a reporting guideline for qualitative research. So just be aware if it doesn't quite fit what you've done. The COREC doesn't always 100% fit when I'm doing my publishing. That's okay, as long as you're confident in your method and that you've done it in a rigorous way. But it's useful for just checking off that you've included everything. So key resources for novice qualitative researchers. The University of Queensland has a qualitative collective, is what it's called, and they usually do more advanced sort of topics, but they've recently announced that for the last half of this year, they're going to go back to basics and do a qualitative 101 series. So if you're doing a qualitative research project, I would highly recommend that series. The talks are usually really high quality from experienced qualitative researchers. So all you need to do to join that group is to email that email, qual@uq.edu.au, and just ask to be added to that group. And you can also access their whole back catalogue of recordings as well, which is useful. These are some other textbooks and resources I would recommend. So if you're doing reflexive thematic analysis, the Braun and Clark approach, there's thematicanalysis.net, where they talk all about their very specific analysis approach. There's also those, I guess, seminal texts on qualitative research. So from Denson and Lincoln, Cresswell is a big name in qualitative research. And I also, for descriptive approaches, really like that descriptive, interpretive, qualitative research. It's just a little book. It's like 100 pages or something. And thank you. That's all I had. I don't know if we need any last questions or comments.
Neil has a question.
Thank you. I thought that was amazing, Caitlin. That was really informative and intuitive as well. I guess I've got two questions. One, a minor one. Did I capture the right email address for that UQ? I think I might have had too many L's. Is it qual? Anyway, but if we could repost that. I guess the second question is, for me, software perspective, I've seen NVivo and it's a few others, and I'm just going through a process of working out what's going to be right for my project. From your experience, would there be any sort of pitfalls, major things to that early career researchers should be considering when they're deciding what software to partner with?
It's a good question. I don't think so. I mean, usually I say to people, NVivo is not perfect, but it's the best we have. It is kind of a clunky system, to be fair, but I do think it's probably the best that we have. No qualitative software will do your analysis for you yet. I mean, I guess we have AI, but it really helps to be able to look between the part and the whole. So you can click on any little bit of coded data and then look at where it was in the transcript and then go look at that quote alongside other quotes in that themes. It's really useful for going back and forth if you're willing to push through the clunkiness of it. But like I said, just old-fashioned doing it in Excel or Word using comments is fine as well. Yeah.
Thank you.
Any other questions for Caitlin? Caitlin, I am not a person at all familiar with Qual, even though I have a couple of publications that indeed have done qualitative analysis. That was brilliant. Thank you very much. I learned a lot from you today, and that was super excellent. For all the people here, this has been recorded. We will pop it up on the TAAHC YouTube channel website in about 24 hours, so you can see it all again there. And I'd just like to thank Caitlin very, very much for today. It was a brilliant presentation. Thanks, and I love your slides. They're very cool.
Oh, thanks, Ray. Thanks, everyone.
All right. Solid overview.
I put the UQ email in the chat as well, just so it's there.
All right, guys. Have a great rest of your Wednesday. See you later.
Yeah.